My name is Melanie Campbell. I'm the president and CEO of the National Coalition on Black Civic Participation, and I am so excited to be back with you with our Black Women's Roundtable Power Table series. We hope you had a wonderful summer, and here we are in the fall of 2021 to continue to have dynamic discussions and calls to actions and dialogues from a Black woman's perspective. Today, our subject is economic security, health justice, and equity for Black women in the care economy, maternal health, reproductive justice, and the COVID-19 pandemic. A lot of heavy subjects, but there's a lot going on in our community. The Black Women's Power Table series addresses issues of importance to Black women and examines potential policy, civic engagement, and community organizing solutions to these issues. This pandemic has exposed and amplified the historic disparities that negatively impact the lives of Black women and families, from inequities in pay and employment, which impacts our economic security, to healthcare injustices that impact our quality of life. Black women have been at the intersection of gender and racial discrimination for generations. Black women, we showed up in a big way to organize, build power, and vote in the 2020 elections. Now, we must continue to demand that our elected representatives show up and pass critical legislation to address and eradicate the disparities Black women have endured throughout the history of this nation. During recent months, the Black Women's Roundtable has been at the center of organizing our allies in a call to action in partnership with the National Council of Negro Women and several other organizations to demand that Congress pass a bold and robust legislative package that invests in paid leave, child care, workers in the care economy, protecting our reproductive rights, voting rights, central to that, and other key issues that address the urgent needs of Black women. We call it the Black Women Take Action, calls to action that we've been doing since July of 2021, and we will continue to do until we win action, as again, with all of our allies, Black women leaders and allies that we've been actively involved in. So I'm going to show you a little quick video.
But today we are gathered in unity in front of the Supreme Court of the United States to also shine a light on the fact that this body has not done its job to protect our voting rights and our reproductive rights. This law, passed by the Texas State Legislature and signed by the governor, denies women our constitutional right to choose and control our own bodies.
Stand up, fight back! When democracy is under attack, what do you do? Stand up, fight back! What do you do? Stand up, fight back! What do you do? Stand up, fight back!
Old battles have become new again. Surely we thought that our mothers had already fought for reproductive rights and won.
Yes.
Surely we thought that the foot soldiers had fought for the right of every American to vote and won. We see over 400 laws just this year being introduced in state legislatures across this nation, trying to restrict the right to vote. And we say no.
Without the universal right to vote, there's no moving forward towards a more equitable country. There is no progress on issues from immigration reform to paid family leave to the minimum wage. Every issue is a voting issue.
And I dare tell you, organized Black women and their allies, we will beat trickery and games every single day. Because yet still we march, still we fight, and still we will vote.
When it comes to elections, women of color matter. Women of color make up more than 20% of the population, and by 2050, we will make up the majority of women in our country. We have been silenced for far too long.
in the right to choose an abortion or for complete comprehensive reproductive health care and for the Equal Rights Amendment. We are the overwhelming majority of this country.
We are demanding the will of the people. Get your bands off my body and keep your hands off my vote.
The very essence of our democracy is that the people have a right to make decisions about the issues that affect their lives. And yet here in 2021, we are back to basics.
This struggle doesn't end. It may not end in your lifetime. It may not end in mine. But you know what? We're not going to give up the fight, because look at us. There's 9 of them up there. There are 435 of them over there and 100 senators, but we are the majority in this country. You won't out-organize us. You won't out-strategize us, and you will not outwork us. So you keep underestimating us. You keep disrespecting us. You keep forgetting how you got there, and you will see what happens.
Understand that not one group of women is safe if any group of women is disenfranchised. Not one. If they come for us today, they're coming to you tomorrow.
Women everywhere should be outraged. People everywhere should be outraged. Human beings that breathe air should be outraged at what is happening in Texas, because Texas is only the start. And if it can happen in Texas, it can happen anywhere.
Thank you, thank you. And that was just on September 15th was our last call to action, because we understand the intersectionality of our issues. So at a core to us being able to win on the issues that are concerned of us, we have to make sure that voting rights are passed in this country. So we ask you to call 202-224-3121. 202-224-3121 and tell the Senate to pass federal voting rights reform now. We also know over the course of the summer that our reproductive rights have been under attack. So we joined forces on September 15th with reproductive justice organizations, civil rights, labor, and other women's rights organizations. And we came together in a show of forces. What that video showed you, a little snippet of that. That we understand that voting rights equal reproductive rights. Voting rights equal economic justice. Voting rights equals access to quality health care. Voting rights, all the issues that we know we voted for racial justice in this country. It means voting rights means we win on our police reform and our criminal justice reform. All the things that Black women told us in our Black Women's Roundtable and Essence poll every year, the critical issues that are important to us. And that's what these power table talks are all about. So next, we will hear from Congresswoman, I'm losing my notes, from Congresswoman Lauren Underwood from the great state of Illinois, who will bring us remarks about the importance of maternal health and Black maternal health. And there's a piece of legislation going on Congress right now that we want you all to also support around maternal health Omnibus Act. So we will hear from Congresswoman Underwood.
Hi, everybody. I'm Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I'm excited to join you for this important conversation about our nation's maternal mortality crisis, which disproportionately impacts Black mothers and other women and birthing people of color. It's unacceptable that the United States, the wealthiest country on earth, has the highest maternal mortality rate in the developed world. And for women of color, the risks are even greater. Black moms are 3 to 4 times more likely to die from pregnancy-related causes than white moms, and Hispanic, Asian, and Native American birthing people also experience elevated risks of mortality and morbidity. As a co-founder and co-chair of the Black Maternal Health Caucus, I'm committed to the critically important mission of advancing legislation to save moms' lives and racial and ethnic disparities and achieve true equity and justice for all. To address the root causes of maternal mortality, morbidity, and disparities, we need data-driven, evidence-based policies that center the voices of families impacted by this crisis. That's why in February, I introduced the Black Maternal Health Momnibus Act with Senator Cory Booker, Congresswoman Alma Adams, and now more than 120 House and Senate co-sponsors. The Momnibus, which I first introduced in 2020 with then Senator, now Vice President Kamala Harris, is a suite of 12 bills that build on existing legislation to comprehensively address every clinical and non-clinical driver of this crisis. For example, the Momnibus includes policies to provide trainings on bias and racism to maternity care providers, ensuring that clinical care is consistently respectful and culturally appropriate for every pregnant person and new mom. But the legislation also recognizes that social determinants of health, like housing, transportation, and environmental conditions, also impact outcomes for moms and babies. The Momnibus includes funding to ensure that every mom has access to the robust social services that they need and deserve throughout pregnancy and for the full year-long postpartum period and beyond. One of the most important social determinants is nutrition. And there's robust evidence proving that the WIC program, which provides nutrition support to women, infants, and children, improves health outcomes for moms and babies and even reduces mortality. However, many families that need WIC the most don't have access to these benefits. The Momnibus would extend WIC eligibility in the postpartum and breastfeeding periods, ensuring that new moms and children can receive the nutritional support they depend on. The Momnibus also includes provisions to support women veterans and incarcerated moms, as well as people suffering from mental health conditions or substance use disorders during or after pregnancy. There's also funding for data collection enhancements and digital tools, investments in the perinatal workforce, and policies specific to COVID-19. These are necessary investments that will save lives and support families, and I look forward to working with my Democratic and Republican colleagues in the House and Senate and the Biden-Harris administration to get the Momnibus signed into law, because every mother deserves access to the care and support they need during pregnancy, throughout labor and delivery, and for the full year-long postpartum period and beyond. So thank you for shining a light on these issues, and thank you for all the work that you do and will continue to do to save lives. I'm so honored you invited me to join you for this event, and I look forward to the day that we're back together again in person. But until then, take good care of yourselves, everybody.
Underwood, again, thank you for your leadership, your stewardship, and we are right there with you and continue to fight issues around maternal health. And so we know we're looking forward to this conversation we're having. And I'm like you, I am so ready to get out of these boxes, but I'm glad that we are able to continue to do the work virtually in this way. So thank you again for joining us today. It's my pleasure now to introduce our senior policy advisor, Jocelyn Tate, who is the senior advisor for the National Coalition on Black Civic Participation and the Black Women's Roundtable, who will take it over from here to give you a little sneak peek about a report that we'll be releasing that talks about some of these critical issues we'll be discussing today through listening sessions that we had. And also, before I turn it over to Jocelyn, I want to thank our media partner, Roland Martin Unfiltered, for streaming this live. We appreciate you, Roland, and your team for partnering and really helping us to get the word out to our communities, and just being the leader that you are and the journalist that you are as well. And we thank you and appreciate you. So, Jocelyn, I turn it over to you.
Thank you so much, Melanie. And as Melanie mentioned, this is a report that we did, listening sessions that we did with our Black Women's Roundtable members in states around the country to find out and get their responses on how they feel about the COVID-19 vaccine, the flu vaccine, participating in clinical trials, and to get their responses on what they think, their recommendations on what they think we need to do in order to get more information out about the COVID-19 vaccine and information out into the Black community. So if we could take those slides really quickly, I'll just run through that really quickly. Now, first, the Black women's responses to the COVID-19 vaccine. 61% of the women in our listening session said that they or a member of their families have contracted COVID-19. And 81% of them said they have or plan to get the vaccine. Now, there were reasons some women did not get the vaccine, and some of the key reasons that women chose not to get the vaccine is because they felt that there was not enough time invested in researching the vaccine before it was released. Also, some of them said that they prefer to use more holistic approaches rather than vaccines to boost their immune system and protect them against the COVID-19 vaccine. And some women also said there was just not enough information that made them feel comfortable released about the vaccine to make them feel comfortable about the clinical trial results and how the results related to African American women. Now, also, the women that we polled also gave some recommendations for what they thought were equitable ways that we could distribute the COVID vaccine and information about the COVID-19 vaccine in communities. They thought that Black churches and faith organizations should be able to work together and collaborate to provide COVID vaccine information and vaccines in the Black community. What they said often happens is you might have a Black church here or a faith-based organization there that is doing work on this, but they're not working collaboratively so that the entire Black community can find out about it. Also, they said that people should be using social media campaigns that include influencers and social media influencers and just public influencers to get out the information about the COVID-19 vaccine, boost more vaccine rates, and debunk some of the myths that are out there about the COVID-19 vaccine. They also suggested that we have intergenerational public events that need to happen in order to debunk some of the COVID-19 conspiracy theories that are out there. And they said that Black doctors should partner with community leaders and advocate for vaccine distribution in Black communities and distribute accurate information about the vaccine in Black communities. So to help to debunk some of the myths that are out there about the COVID-19 vaccine, so that our Black community can make more informed choices about whether to get the vaccine. So those are just some top line key responses that I wanted to share with you today, and look forward to a full report that we will be releasing soon. And what I'd like to do now is turn it over to the moderator for the day, Michelle, Michelle, the Indie Mom of Comedy. She is our social media and social justice advisor at the Black Women's Roundtable. So Michelle, the floor is yours.
Thank you so much, Joycelyn, for elevating my title today. I am certainly not a social media person, but I am the senior advisor for social justice and cultural expression here at the National Coalition for Black Civic Participation and the Black Women's Roundtable. And I'm super excited to be here to moderate this outstanding panel of women who have been working in the field of maternal health, reproductive justice, and all things equitable as it relates to women's health and COVID-19 as well. But before we jump into the panel, I'd like to take a moment. Again, cultural expression is something that we have always done as a people, and it's the way in which we've spread our message through storytelling. And we're super excited to have this artist with us today who has performed an original piece around maternal health. She's a spoken word artist who hails from the great city of Baltimore, but performs all over the country as a spoken word artist. Please help me bring to you Sister Tracy, who will be sharing a piece about maternal health. Sister Tracy.
The big pink elephant in the room is no longer silent. She now has black and brown bodies tatted on her body. You see, they say that when Massa had us as his property, he seemingly treated us more properly because he can make a profit, you see? And though it doesn't make sense, it totally makes sense. Because if it's not making dollars, to most people it doesn't make sense. What are we worth? God says we're priceless, but they say we're nothing. But we are magic upon magic. We are the mothers and fathers of civilization. Everything that exists comes from us. but we're still treated as nothing. God is so impoverished that we have poverty pirating, misery parading as glamorous living. Got us all working 9 to 5 and 5 to 9, hardly having a dime for anything that matters. Got us ignoring the knocks and the pains, the lumps and the bruises. Got us thinking that, well, my mama had it and her mama had it and her mama had it, so I guess it's hereditary. No. It's healthcare crisis living in our bodies. It's the untold stories, those cries and those screams and those moans of those mothers and those daughters that live in cemeteries now, dreams deferred, because they no longer have an opportunity to be heard. But we're here. They are our ancestors, and their spirits and their energies are calling us near, having us speak on their behalf. We are their voices. No longer will the pink elephant sit in the room silent. She is now dancing to the beat of the drum of those black and brown bodies that need to be heard, the voices that need to be listened to. The silence is deafening. We want it to be heard. These moratoriums that are being spoken on behalf of black and brown bodies, women whose voices have been silenced because healthcare disparities exist. We are in America living in third world country experiences. Our cancer rates are higher. Why? Our mortality rates are higher. Why? Our heart disease rates are higher. Why? Our infant mortality rates are higher. Why? Here we are, great black magic. Magic in the making. And we're mistaking sparkly things over healthcare. We're making choices for people who aren't here. But we have enough of our sisters in the grave whose voices speak louder if only we will take the opportunity to hear. You see, Massa treated his property more properly when he could make a profit, you see. But there's a prophecy that talks about equity. And if you look at Isaiah 1:17, you'll see it for yourself more properly. Here we are, poverty, pirating, misery, parading as glamorous living. Our health is in crisis, but we're not hopeless. You see, who makes these laws that we're supposed to live by? They do. But who has the power to change them? We do. We're not powerless. We're magic in the moment. This round table is magic in the moment. Because I know sometimes it feels like we're climbing up a mountain and nobody is there to see us through. But God sees us through. And as long as we can connect to others like me and you, we will make it to the other side. Because the race is not to the swift, but to those who can endure to the end. And the end is not the end until the end of this is in sight. We have a job upon our shoulders. Because Massa treated us more properly when he saw us as his property, because he can make a profit, you see. And it doesn't make sense for him to treat us properly when all we're doing is pirating poverty and misery, parading itself as glamorous living, ignoring the lumps and the bumps and the kicks and the tears because we're scared. But our ancestors are here, and they're cheering us on. They gave us their life's baton, and it's time for us to move on, because the pink elephant in the room is tattered with their black and brown bodies, and we have a job to do. May God bless us to be equitable and to be just and to speak the truth. We're not powerless. We're powerful. And as long as we remember that, then the mountain will be able to be conquered by me and you. Thank you for giving me this opportunity. Peace.
For that poignant and beautiful piece. Excited to move into the next realm of our power table talk with Black Women's Roundtable. And I want to take a moment to introduce our panelists. We will be hearing from Denise Pines, co-founder of Women in the Room Productions, member of Board of Directors for the Federation of State Medical Boards. We'll also be hearing from Dr. Jewel Mullen, Dean of Health Equity, Dell Medical School, University of Texas, and former Deputy Assistant Secretary for Health at the U.S. Department of Health and Human Services. We'll be hearing from Dr. Jamila Taylor, Director of Healthcare Reform and Senior Fellow of the Century Foundation, board member of Black Mamas Matter Alliance. We'll also be hearing from Kenita Seeley, Policy Counsel of Black Women's Health Imperative. We'll be hearing from Dr. Doris Brown, past president of the National Medical Association. And finally, we'll be hearing from Ms. Wula Dawson, Communications Director of Sister Song, Women of Color Reproductive Justice Collective. And so we're going to bring our panelists on. Hello, ladies. Hello.
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 So good to have you all. So good to have you all. Really excited to start this conversation. And this first question, is actually for all of you. If you all could answer this question in no specific order. I guess maybe I should direct you a little bit. But the first question is, what is health justice and equity? And what does it mean for Black women as it relates to maternal health and the COVID-19 pandemic? So maybe we should start with our past president of National Medical Association. Dr. Brown, could you answer that question for us, please?
Yes, thank you so much for inviting me, one, to be a part of this esteemed panel. But to answer the question in reference to health equity and justice, we really have to understand what health equity is. And health equity is really a state that experiences where everyone has the opportunity to attain their full health potential. And that is socially, economically, including those social determinants. And when we look at it, it's the equity, it's not that one size fits all, so it's not equal for one person or the other. And we look at equity through a lens of comparing the privileged and what they have in comparison to those of us that are less advantaged. And of course, we want to bring about all of the social determinants to make sure we have equitable, quality healthcare for all.
Thank you so much, Dr. Brown. Can anyone else from the panel just jump in and give us your working definition or the definition of health justice and equity?
Sure, I could jump in here. I definitely echo Dr. Brown's statements. I think, health justice and equity means that we have access to quality and affordable health care. It means that Black women aren't in the middle of a maternal health crisis and aren't dying at 3 to 4 times the rate as white women for pregnancy-related causes. It means that critical legislation, such as the Black Maternal Health Omnibus Act, gets passed, and that Congress invests in Black maternal health by passing the Build Back Better Act and ensure that postpartum Medicaid coverage is extended to a year. These are just some of the things that we need, Black women need, to achieve health, equity, and justice.
Thank you so much, Ms. Seeley. Someone else wanted to chime in.
Yeah, I wanted to just chime in and agree with everything that's already been said. I would push it a little bit further, though, and focus on the justice aspect of these concepts, and to say, I think that when we realize health justice in this country, it means that we have a healthcare system that works for everyone. We have a healthcare system that not only takes into account things like the social determinants of health, but also how multiple oppressions like racism and sexism impacts a person's ability to thrive and have optimal health and well-being.
Thank you so much, Dr. Taylor. Sure.
I know we're going to keep building on one another, so I can't resist. And going back to Dr. Brown's reminding us that health really encompasses physical, emotional, and social well-being. I think it's really important as we think about equity and the fact that your race and gender should not determine your ability to have the highest state of physical, emotional, and social well-being. On the justice side, I would say to get health equity, you have to have justice. And that does require attending to all of those the policies that have been baked into our society for so long and held women and so many people down and back. But there's also a piece of not adding new injustices and new inequities or barriers along the way, which is part of where we are right now, trying to make some progress, but also being in a vicious cycle of a little progress and backsliding.
Thank you so much. Thank you so much, Dr. Mullen. Thank you so much. I think there was one other, Denise Pines. Yeah. What would you say health justice? I know you're going to build on like Dr. Mullins and Dr.
Right.
Brand, but what would you say, Denise?
I think all, when I think about it as it relates to Black women, I see it sort of this way, that if Black women need more care during maternal care stage because she's at greater risk, then she doesn't get equal care. She gets the care that she needs, which may mean that her care is more than that of other women. And especially when we're talking about Black maternal health, we know that she needs more than other women. And so for me, that's where both the justice comes into it to make sure that that happens, but what the equity actually means. That equity is not necessarily equal. It is what that person needs, what that group actually needs.
I really appreciate that's an amazing distinction. Thank you so much, Denise, for sharing that distinction with us. And then let's also hear from Woola Dawson.
Yeah, absolutely. So, Sister Song is the holder of the framework of reproductive justice. And that was initially, right, holding social justice and reproductive rights and putting them together. And we hold maternal health right in the middle of reproductive justice, right? We know as Black women that we had to both fight to not have the children that we weren't prepared to take care of, and also fight to have the children that we want to have to live. And, in the context of maternal health, it's so interesting to think that, right, we've heard statistics about how health outcomes in third world countries for Black women are very similar to the health outcomes for Black women in the United States. And so I think sometimes a valuable approach thinking about equity is to really, really step back and have a beautiful vision of the fact that America is brand new. And these oppressions that have happened on this continent and on our bodies is just a blip in history. But we have centuries of times that we have been taking care of our bodies, right? We have been birthing children with limited resources and having beautiful outcomes before the American Medical Association came in, before these oppressions became so entrenched. So I think having a vision of just like this knowledge and birthright, that we know how to take care of our bodies, and that there is this information that we already carry, that we can continue this legacy of taking care of ourselves and our bodies and having children as Black women and Black people. And that beyond the policy and the structural changes that we need to know, but having this vision and this kind of knowledge that we actually know what we need, I think is an important component.
Mm-hmm. Thank you so much. Thank you so much. And I really appreciate how you each brought your own space and piece to that question. So much so that the next question is for all of you as well. This question is, in light of, and I can't wait to hear your responses, in light of the recent U.S. Supreme Court decision to decline to block the new Texas abortion law, SB 8, what impact will this decision have not only on Black women in Texas, but for Black women across the nation? I'm going to ask each of you to answer that question. Let's start with you, Denise Pines. What impact does this Supreme Court decision have?
I mean, there's so much to say, but I'm going to be nice right now. I think the passage of this law and the stance that the U.S. Supreme Court took is really the beginning of setting women back to the 60s and the risks that are associated with backroom abortions. It removes the safeguards for women's health, especially access to time-sensitive care, which is what women find themselves in when they decide that they want to have an abortion. Abortions that are later in pregnancy typically cost more than procedures performed at earlier gestational ages. So delays in obtaining, care likely to create really dire obstacles in obtaining care at all, especially for people who have financial limited resources, like we find many Black women do. When pregnant women don't have access to abortion care and instead are forced to carry a pregnancy to term, or long-term, they find like they have long-term physical and emotional and mental health suffers, right? And in addition, the families suffer, and then the communities are impacted. And we know this, we have studies on this, that women who are denied abortion have an increased likelihood of being unemployed, having household income that's almost 4 times the federal poverty level. And they report an increased likelihood that they don't have enough money to even pay for the necessities that they need, like food and housing and transportation. And they're more likely to stay with a violent partner if that's the partner of the child that they're carrying that they wanted to abort. So Texas is what they're going to find is they're going to experience more women accessing government federal, services due to homelessness, due to abandonment, due to emotional and physical abuse, unplanned visits to the emergency room, child protective services involved, and lost jobs, among other, barriers that we'll see. And this is the invisible impact of that one law.
Thank you so much. Thank you so much for that, Denise. Dr. Brown, what do you see as the impact of this Texas abortion law?
We, as the National Medical Association and about 40 other healthcare organizations, we are outraged. This is the most ridiculous thing that you have, it really gets you upset. But we strongly, strongly oppose the law and regulation because it's interfering with the relationship between the patient and her healthcare provider. And that sanctity should not be interrupted by having a policy or law that's coming into place, because patients depend on their healthcare providers to help them to make those critical decisions that's going to impact their health and their lives that they may be carrying. And so it's really a very personal thing, and the law has no business interfering with that. And I can say the National Medical Association, along with the American College of Obstetrics and Gynecology, have signed on to an amicus brief that's submitted to the U.S. Supreme Court addressing this. And the case is Dobbs versus the Jackson Health Center, which is in Mississippi, and again, trying to put in the same kind of law. And so we must stand up and take charge. And we have to write to our congressional representatives. We have to have an involvement both at the state and local legislative level, but also with our congressional individuals, as well as writing to the Supreme Court. This is ridiculous. And we know, as we've heard from the young lady that gave the beautiful poem, this has some economic overtones to it. So let us not be fooled.
Thank you so much, Dr. Brown. Dr. Brown, thank you. Dr. Taylor, what about your thoughts on that? On this Texas abortion law and the impact in the Black women in Texas, but across the nation as well?
Yeah, absolutely. I mean, basically what this law would do is make abortion inaccessible, particularly for women in Texas. And I think what we're going to see nationally is that it's going to have a cascading effect where more states are going to adopt similar extreme restrictions such as this. And we're already seeing signals of this in states such as Florida, Oklahoma, Arkansas, and others. And then I'll just also add that abortion is essential health care, and Black women already experience challenges accessing it, which we've already heard, everything from a lack of insurance coverage of abortion. It can be cost prohibitive, especially if they have to delay the procedure, which we've already heard. And restrictions like this also fall hardest on us and have implications for our broader reproductive and maternal health.
Thank you so much, Dr. Taylor. Dr. Mullen, you have a very, very intimate relationship with the great state of Texas. How do you feel about this legislation in terms of its impact on our community, Black women and Black women across the country?
Well, as I sit here in Austin, Texas today, I feel very happy to be on this panel with you. And I'm going to build on some of the other comments and echo that abortion care is a fundamental part of healthcare. And so often attacks to women's healthcare when they focus on abortion sometimes ignore that the sites that provide abortion care are also sites that many women who are and underinsured go for other fundamental reproductive care services, screenings for HIV and sexually transmitted infections, cancer screenings. In Texas, where the Texas Medical Association refers to this state as the uninsurance capital of the country, it's particularly then a challenge for Black women, who are 12% of the population, but 16% of Black women are uninsured. 26% of women in Texas are uninsured altogether. So this law is also putting sites out of operation, which is going to further limit access to care. Another concern, though, for the physician who's also concerned about public safety, is that we have now taken another step into criminalizing something which should be a fundamental right, trying to get access to care. And when the remedy for that puts interventions in the hands of the general public, then I can only envision another list of say her names if I have to worry about who's going to be harmed in trying to get care for herself. And then the last thing I just want to cite, working in a medical training environment, is that specialties that are chosen by Black women are oftentimes the primary care specialties of family medicine and OBGYN. So there's also the potential impact on those providers who don't just go into a field to provide abortions, but who might also be more subject to harm for trying to give people the care that they need.
Thank you so much, Dr. Mullen. Thank you so much for that very, very, very data-driven insight. I think you guys heard that 26% of women in Texas are already uninsured. Powerful, powerful truth. We want to hear from you as well, Kenita Seeley and Ms. Woola Dawson. What do you think about this Texas abortion law and its impact on Black women in Texas, but also across the nation? Let's start with you, Woola.
Absolutely. So we know that this was a coordinated attack that's been going on for years to dismantle Roe. And at this point, I think it's important to say that our opposition has out-organized us, right? So people have already talked about how similar legislation is already happening and all across the country. I think it's also important framing to remember that abortion bans are specifically white supremacists, right? The same people who are white supremacists are the same people who are anti-abortion. I recently worked at our local clinic here in Atlanta, and the protesters out front know how to talk to Black people about getting abortions. And so I think that's an important framing, that we are the targets of these bans. And so I think it's so exciting that more people like all of us on this panel are talking about abortion. We're saying abortion, because if we are going to win and we are going to not fight for what we had in the 60s and what we've had, but even expand, right? Because we know under Roe, Black folks didn't even have full access to abortion, right? Like, we were still, as folks talked about earlier, right? We have transportation barriers, we need childcare, we have insurance barriers, right? So I think it is really important for us to think about how important it is for more people to say abortion, to talk about abortion, to do that culture change shift so that we can protect our people in this fight as this movement expands.
Thank you so much, Ms. Dawson. Ms. Seeley?
Yes, absolutely. And I echo everyone's statements here and build upon that. I mean, the impact will be great. I mean, for Black women in Texas and nationwide. I mean, there are 7 million women of childbearing age in Texas. This measure will create nearly insurmountable obstacles for certain vulnerable populations, including women of color, undocumented immigrants, low-income individuals, teenagers, who really don't realize oftentimes that they're pregnant until later on in their pregnancy. So there's that health aspect. Again, we already Black women face high maternal mortality rates. Also, chronic diseases, which are more prevalent among women of color, can make pregnancy life-threatening. And according to the Guttmacher Institute, statistics reveal that about 70% of abortions in Texas in 2019 were provided to women of color. So our health and our lives are at risk by having to carry these pregnancies to term. As my fellow panelists said, undoubtedly there will be other states following Texas' lead, and there's also evidence of that already. And these anti-abortion state legislators that will try to enact similar laws, particularly in the South, which will have, a devastating impact across the country. And of course, you already have the economic impact. Black women have diminished access to networks and resources to overcome the financial obstacles to accessing healthcare. People of color and women are disproportionately represented in low-wage jobs and continue to endure discriminatory wage gaps. For example, Black women are typically paid just 63 cents on the dollar for every paid to a white man. So people seeking abortion may have to make some difficult decisions. Are they going to choose between paying their rent, purchasing food, or other basic necessities, or receiving abortion care? So these are all, and also the Black community, especially Black women, are bearing the brunt of the pandemic that we're still in. So this economic uncertainty and lost jobs have forced many people to work even harder to make ends meet. So for these multitude of reasons, it's going to be, for Black women in Texas and nationwide, will all be in jeopardy if the Texas abortion ban or other similar laws are allowed to stand.
Thank you so much, Ms. Seeley. Thank you so much. And with that in mind, there's a question that I have posed specifically for you, Ms. Seeley, and for you, Wula Dawson. This next question: last Friday, the House passed the Women's Health Protection Act. What's in this bill, and will it advance reproductive justice for Black women, Ms. Seeley?
I think, to answer here, yes, great news that it was passed by a vote of 218 to 211 in favor, which would protect the right to access abortion care. This move came in response to, of course, the strict abortion Texas law ban that took effect on September 1st. The Women's Health Protection Act safeguards abortion access by creating a statutory right for healthcare providers to provide and a corresponding right for their patients to receive abortion care free from restrictions and bans. The new legal protection would safeguard access to abortion in every state against restrictions like the 6-week and the 15-week bans, mandatory delay periods, biased counseling, and medically unnecessary ultrasounds. If enacted, WIPA would protect the right to access abortion care in every state, even if Roe v. Wade were weakened or overturned. By passing WIPA, Congress would protect abortion rights and access nationwide, taking a critical step toward making sure every person is free to make their best healthcare decisions for themselves, their families, and their futures. Now that it's passed in the House, it's headed to the Senate, of course, where it really doesn't stand a chance of passing due to Republican opposition and the filibuster remaining in place. Every day without congressional action means that more people are being denied their constitutional rights to protection, right to abortion. So there's really an urgent need to pass these federal protections and for reproductive rights before it's too late. As far as for Black women, the Black and Brown communities are disproportionately suffer from the abortion restrictions. So yes, WIPA goes a long way to restore and advance the reproductive rights of Black women by mitigating those financial and logistical barriers that we talked about earlier. So Black women can realize their reproductive autonomy. So yes, I think it's a great thing that this passed in the House. We're looking forward to moving it through the Senate, although there's definitely opposition, but it will go a long way to advancing Black women's reproductive rights.
Awesome. Thank you so much for helping us unpack that and understand that a little bit more, Ms. Seeley. Ms. Dawson, what are your thoughts about the it being passed in the House?
I mean, that was such a thorough summary of all of its implications. I think I will just add anecdotally that I think it is important to, enjoy this moment. We're tired. Aren't you tired? I'm so tired. We are fighting so many levels of oppression. We're in the middle of this pandemic. I mean, right now, I just think about being a parent in Texas right now, having to put your children in school where you aren't even sure that your babies can be safe, and then having to navigate an unexpected pregnancy right now. And the concept of driving, I've heard stories about folks who want to keep their pregnancy private. And so they take a 12-hour trip to another state to get the procedure and try right back so that they can get the care that they need, right? So yes, just to share a story about why it is so important to advance proactive legislation that folks have worked on for a very, very long time in order to codify this very basic human right to abortion care and reproductive health care.
Thank you so much, Ms. Dawson, for that. We're going to move on to the next question. And this one is specifically for you, Dr. Taylor, and for you, Dr. Mullen. What are the top maternal health challenges that Black women are facing? And what are 1 or 2 solutions you can recommend to address these disparities? For example, implicit bias in medical treatment, et cetera, et cetera, et cetera. So please help me with that, about the top maternal health challenges. Dr. Mullen?
Okay, so we've already talked a lot about the issues related to access or poor access to care and what that means in general. So I want to focus a bit on a lot of the very important conversation around poor maternal health, maternal mortality. Remind us that many of the risk factors for maternal mortality overlap the risk factors for infant mortality. And then to say, because I work in the health system, that it's time for us, even as we say implicit bias, I have promoted the notion that sometimes we use that term to sugarcoat racism, and not just structural and societal racism, but the institutional racism inside of health systems that need to own their own accountability for assuring that women have good care for chronic disease prevention, because we know that a lot of maternal mortality is related to preventable conditions that might be linked to poor control of diabetes, hypertension, advanced maternal age. And so I think a really important solution is to move from saying, yes, we acknowledge bias and we acknowledge poor access and poor quality, and to build more accountability into the systems that are responsible for fixing those things. And so there's my view is to bundle a lot of this into what we have shown to work for things such as reducing healthcare associated infections, which are not the same thing. But when you hold systems accountable through government action, through CMS and others, then health systems have to perform better. And so a quality and safety effort that's called a just culture can also promote justice if people are held accountable to fix the things that they can. And because I'm a doctor that pushes on my fellow clinicians about this, I just want to add that I am really pleased that so many in the healthcare field appreciate the impact of social determinants of health on women's ability to be well and whole. But that does not remove their obligation to address the structural determinants that we in the health system sometimes also uphold. And I think that's an important thing to add, even if legislation that's really essential gets passed.
Thank you, Dr. Mullen. Dr. Taylor.
Yes, happy to jump in on this one. First off, I want to say that it's hard to pick 1 or 2 things because the issue of maternal mortality and morbidity in this country is multifactorial, especially when we center Black women in the conversation about this issue. I think the legacy of medical racism has led us to a place where, we continue to see Black women not listened to by their providers. And that is a key aspect of, our experiences when it comes to childbirth and even in the postpartum period. And we've heard that from stories that have been elevated in the media from, folks like Serena Williams, who are famous and who everyone knows about, down to people like Dr. Shalon Irving, who worked for the Centers for Disease Control and Prevention, who lost her life in the postpartum period, after having a baby. And so all of these stories are essential to how we think about what Black women continue to experience in the healthcare system and how that drives these needless deaths and other challenges when it comes to maternal health. I'll also say, too, that another issue is gaps in insurance coverage. For one thing, we know that Medicaid postpartum coverage ends just 60 days after giving birth, which is certainly not enough time for, as a new mother, for your body and your mind to heal from having a child. And so there are efforts to advocate that postpartum coverage is extended to a year postpartum with full coverage and benefits. And luckily, there are policy efforts underway right now in Congress that would help resolve some of these issues. Congresswoman Lauren Underwood talked about the Black Maternal Health Omnibus Act, which includes investments in things like the social determinants of health, like addressing implicit bias and racism in the healthcare system, funding frontline community-based providers, and more. And this is included in the Build Back Better Act and reconciliation bill that's currently being considered in Congress. This is the social infrastructure bill that you may be hearing about in the media. That legislation also includes a mandatory and permanent extension of postpartum Medicaid coverage up to 1 year with full spectrum benefits. So there are some solutions that are currently in front of Congress, and we are working to make sure that they get over the finish line.
Thank you so much, Dr. Taylor. It is invigorating to get such insight from you ladies. You all are so amazing and certainly know so much for us to understand and learn. I'm going to ask this last question this is next to the last question. This is for Denise Pines and for Dr. Doris Brown. We know that the COVID-19 pandemic has exposed the historic inequities in healthcare for Black people. We know that, right? How has the pandemic exacerbated healthcare inequities for Black women? How has COVID-19 exacerbated the inequities for Black women? Let's start with you, Dr. Brown.
Thank you. Well, there have been many factors that have come about as a result of the pandemic, but we know from data that Black women, over 75,000 Black women deaths have occurred as a result of these health inequities. We have chronic stress that's due to the racism, and it affects us at all levels. And I've been hearing about some of the structural and racial barriers, but we also have to bring into play that and some people will call it unconscious bias. I think that many times it is bias that we have into the health system. And what we found when you start to look at, and many people have had a misunderstanding of, well, COVID came along and we have a vaccine, but the vaccine was rushed. And I think many of the points that were brought out in the earlier presentation, well, for those women that have a view that it was rushed, they don't understand the level that more than 20 years of research was going into developing this vaccine, especially the mRNA vaccine. It was mislabeled, I believe, by saying warp speed, and that got people to thinking along a different level. But I think we need to really sit down and have that conversation with people that have a fear of getting the vaccine, that thinks that, and there's many misinformation and disinformation sources that are going around, that we want to sit down and have a conversation with the individuals where they are, so that getting the vaccine and protecting their health is going to be an important thing. But I think it's also important that you want to deal with a trusted resource in your community that's going to talk to you and answer all of your concerns before you get the vaccine. But what has happened in this as a consequence of the pandemic, women stopped getting screening and screening for preventable conditions, such as we know that mammograms, the areas were decreased so that the number of women delayed getting that mammogram. And so we're finding coming in now that there's an increased risk, incidence of breast cancer, the cervical cancer screening, all of the preventable conditions, because many times when we were isolated, we were not able to go see the doctors. Some of our healthcare providers didn't have the telehealth modalities in place or could not pay. And then you still have the issue of about insurance and whether it is covered, the ability to pay. So I think the pandemic has created a whole other system that's going to impact particularly Black women in getting their reproductive health, getting the prenatal care that they have when they are pregnant because of the fear. And then, of course, the fear of getting the vaccine. And if you move, I hope soon beyond the pandemic, we will be dealing with some of the chronic long-term impacts of this pandemic.
Thank you so much, Dr. Brown. You know, to be quite honest with you, when you said that the screenings that we typically took were halted during COVID, I can honestly say that that impacted my life. I was unable to get a mammogram during COVID, in the deep parts of COVID. And so I missed an entire year of having that screening, only to get it this year and for them to find a carcinoma. And so for me, that point that you made, if anyone is paying attention, it's real. And had I not had the support, I'm an artist, so I wasn't working. Had I not had supportive friends, supportive family members who helped me maintain my health insurance, it may be a different outcome for me. I went on to have to get several procedures to really deal with what was found in my own diagnosis. And so that really hit home for me. And I wanted to share that with those who are paying attention. These are some of the direct results of COVID-19 on Black women. And so to wrap that piece up, Denise, can you give us your take on how COVID-19 has really lifted up the historic inequities in Black women's health?
Important thing is, you know, it played out in us living longer, right? So in 2020, life expectancy for all races dropped, but sharply for Black and Latinx people, right? It dropped, 1.2 years, so to 77.6 years for white folks. 3 years, it dropped for Latinx, and then 2.9 years, it dropped for Black people down to 71.8 years, right? That's almost 6 years differential between Black people and white people. So now, so not only do we have the challenges of losing our life during this pandemic, but we also now have the risk of a shortened life, right? During a time where we spend so much on healthcare, that more than any other developed country, and yet we have the worst outcomes of we're like ranked almost 35th in certain areas. In Black women's maternal health, we're ranked 99th, right? I mean, some of this data is mind-boggling to me, that we live in this society of 2021, and we're still talking about resolving issues that my mother had to deal with, and I'm in my 50s now. It's ridiculous. So the CDC has shown that Blacks and other people of color were hit really, really hard with the pandemic. We all know that data, right? And now they're quantifying that data. They're doing all kinds of statistics with it and trying to really narrow down who exactly. And so who exactly the 1 in 4 were the 65 and older who happen to be Blacks, Indigenous, and other people of color. And a lot of that group is on Medicaid, right? And a lot of older people are in understaffed nursing homes or in nursing homes with 4 other people living in the rooms. So the generations of racist policies continue this inequity that we find in the communities, and we just can't catch up. And we're so behind, we just continue. And the more and more you have the kind of laws that Texas is passing, further continues this, this race of being behind so far that we almost can't even see the guy out front anymore. The pandemic has intensified and revealed all of these challenges. I mean, that's the good thing, right? Because before, people wanted to say that everybody has equal access to healthcare and all this sort of stuff. And the pandemic really showed that it did not, and it continues to show that. And we have this opportunity actually to elevate that, during this George Floyd time that we're in, which will be a short period of time of folks really recognizing and putting the kind of energy and the financial engine behind changing some of these things. But there's disparities in health that even extend into dementia care and the ability to simply get a diagnosis for dementia care. And the Alzheimer's Association in March revealed a report that found that older Blacks and Hispanics are more likely to have Alzheimer's disease or other dementia compared to white people because they simply get misdiagnosed. And I know we probably will talk about why are they getting misdiagnosed? But, that comes down to the social determinants, right? Where you live, how long you live where you live, right? What opportunities to education you have, what access to wealth building you have, and all of that equates to the quality of healthcare that you actually can get in this country.
Thank you so much, Denise. Thank you so much. We are going to close out this last part of the panel. And I just want to thank you all for sharing so many amazing insights. I feel like we've all had our own plenary, our own accelerated maternal health course today. And so I feel really privileged to have been able to moderate this. That being said, we're going to have a rapid response question for all of you who are still here with us. We want to thank Dr. Doris Brown, past president of the National Medical Association, who had to leave. She had another engagement, but we want to thank her for her great insight and her truth and her justice for our maternal health. So we're going to ask you last ladies to just quickly answer this question. What is your organization doing to address these issues we've discussed today? And what's the one action item you would recommend for Black women watching to empower themselves to get the best medical treatment? So let's start off with you, Willa Dawson. What is your organization doing? And what's one action that you'd recommend for Black women?
Well, right now, Sister Song is preparing for a national day of mobilization all across the country. So our executive director, Monica Simpson, will be speaking in DC on Saturday. I'll be speaking here in Atlanta. We'll be in Kentucky and in North Carolina. So I encourage folks to, if they feel safe, to participate in the action. And I also just want to encourage people to say abortion, tell your abortion stories. And if you get an opportunity to hear someone else's abortion story, please listen deeply and with empathy so that we can hold each other as Black folks through this challenge for more reproductive justice.
Thank you so much, Wula. What is your organization doing? Kenita Seeley, what is your organization doing?
Yes, well, the Black Women's Health Imperative is a national nonprofit organization dedicated to advancing health equity and social justice for Black women and girls. So this is really our organization's daily work. So through policy, advocacy, education, and research, leadership development, we speak to those a variety of health issues, including the ones discussed today. We're currently addressing COVID vaccine hesitation, reproductive justice, and all the abortion measures, stop these anti-abortion, these abortion bans going on today. My recommendation for Black women watching to empower themselves to get the best medical treatment would really be to be your own advocate. You know your body best. Unfortunately, it's been exemplified time and time again, like with Serena Williams, where she had to press to say that something was wrong with her body. Some health professionals may try to dismiss you or tell you that's something that just doesn't really comport with how you're feeling. So you really have to be your best advocate, and you know your body best.
Thank you so much. That is so true. That is so true. Who do we have left with us? Dr. Mullen, what's your suggestion? And what is your organization doing? What do you suggest that we do as Black women?
So as one of the leaders of a medical school that is a part of the state university system. I'm really proud to work with colleagues across medicine, nursing, social work, and pharmacy, law, and others to bring the evidence to inform policy. We leave the politics to the politicians down the street and around the corner, but we continue to bring forward everything that we know about the positive and negative impacts of good policy and bad policy and how they're playing out locally and across the country. So that's been really, really important for us. And we have to continue to do that. As we do that, we also work with organizations that are local who are drivers of change, such as our own Black Mamas Matter collaborative, who not only have educated clinicians in hospitals, but they're also essential to helping our learners who are going to become the future healthcare workforce. In terms of like what my prescription or one action would be, I'm going to go back to the spoken word. It's because I came to this thinking, what I really want Black women to do is not wait to be empowered, but to know that we have power, to know that we are not victims, and driving that change that we need on behalf of our own health across a life course means that part of owning our power is declaring to the people that we rely on for help with our well-being is that they need to behave in ways that demonstrate that they're trustworthy. Because the power to do the right things for ourselves also means that we need to feel good and confident about the information that they're giving us. But I do believe we can get that, do that, and that conversations like this are reinforcers.
Thank you so much, Dr. Mullen. And we'll close out with you, Denise Pines. What is your organization doing? And what's one thing you would tell Black women to do to support their health?
Well, thank you for going last. So Birthing Justice is sort of what our organization is doing. It's the name of the film that I'm producing. It's examining the crisis of Black women during childbirth or even shortly after at the rates that are higher than in 1987. But we'll also look at what's being done to prevent those deaths, right? So it's not going to be an all doom and gloom type of presentation, but like across the country, what are some of the unique things they're doing? Of course, we'll touch on the legislation across the country and also even in the state that I'm in, which is in California. And we hope that this will broadcast in the fall of 2022. Now, for Black women, what I think that they should do, one of the best ways to get good medical treatment is to be prepared for your doctor's appointment. Before you go is to write down your symptoms and be specific. You know, is the pain sharp or dull, or is it stabbing? How long have you been feeling that pain? Where is it exactly? You know, like know the area. If you got to put a dot on your body, all of this really, the more detail, the more you can get the right kind of care and treatment. And take somebody with you and have them actually physically go inside the room with you, have already shared with them what you're going to talk to the doctor about, just in case you get nervous and forget. People get nervous in front of the doctor. People don't want to tell the doctor everything that's going on with them. They don't want the doctor to judge them in any kind of way. But you only have 12 minutes for that doctor on average for each patient to be able to know whether or not they can give you a proper diagnosis. So if you're prepared, you're more likely to have a better outcome than if you weren't prepared.
Outstanding. It sounds so simple, right? It sounds really practical. It sounds really easy, but you would be amazed at how many women, particularly women of color, particularly Black women, who don't feel empowered, as you all share, to advocate for yourselves. And so thank you for that. Ladies, thank you all so much for all that you are doing for Black women's maternal health, reproductive justice in light of all of this COVID-19 pandemic and beyond. And thank you for being champions with the good information, with the insights behind it. So we applaud every last one of you. That being said, thank you again to Denise Pines, Dr. Jewel Mullen, Dr. Jamila Taylor, Ms. Kenita Seeley, Dr. Doris Brown in absentia, and thank you, Woola Dawson, for all of your insights during this Power Table Talk. We're going to close this out right now with our president and CEO, Melanie Campbell. Melanie, I'm going to give it back to you.
Hello. Thank you, ladies. That was powerful. thank you, Michelle. Thank you, and Denise. I hadn't seen you in 1,000 years.
I know, right?
But thank you all so very much. What you brought, I was taking down notes, and I was like, yeah, I when you said that last comment, Denise, about not one. First of all, I don't want a doctor to tell me, I try to lose 10 pounds before I go to the doctor. Right? Crazy, right? And being real transparent, we do crazy things. We want to get a good report from the doctor. So you came on my street with that one, right?
Okay.
About how we don't want to have fear, about going and getting bad news. So I want to thank you all so very much for all of what you brought to this conversation. And I know we didn't connect just in passing. I know we will continue to work together. Look to hear back from us. We want to continue to share. So much going on, and everybody's under so much stress. So thank you all for your leadership, your sisterhood, and doing all you're doing. And thank you again, Michelle, for being our hostess for the day, as always, and bringing the kind of light and energy to this conversation and sharing your truth about what you've been going through. Appreciate that.
Thank you.
So we will close out our fall Power Table Talk. Thanking again. First, I want to give a special shout out to Jocelyn Tate, our Senior Policy Advisor, for her hard work, and all of our team on the back end, Acacia and Antoinette and Angelo and Tanya and Josh, and I get to call them names, but you all know who you are. There's no such thing to do this work with just one person. So it's a team effort here at the National Coalition and Black Women's Roundtable. I want to thank Roland Martin Unfiltered again. And I want to, those of you all who are still tuned in, and we hope you stay just a couple of more seconds, a couple more minutes. I want to challenge you to get involved, stay involved. Join us with our Black Women Take Action calls to action. We will continue to be on Capitol Hill, pushing our elected officials in the House and the Senate, pushing the Biden-Harris administration, because we know Black women, we turned out. We want to make sure our issues are addressed, our agenda is actualized. And so we have to speak up and make sure that the things that we voted for actually take place, so we can have the best quality of life for Black women, our families, for Black men, for all of us, quite truly. And so we're going to close out with another video, just closing out, just to share with you our continuous also call to action around voting rights and how critical that is. And again, as I said at the beginning, all issues are critical, and without the right to vote, we're not able to move on these issues from a federal level down to a local level, because all politics is local. So we'll show that video and ask you to continue to follow Black Women's Roundtable and stay with us, and we will win together. So thank you, and enjoy the rest of your day.
Why are we here? Because our voting rights are under attack, and our democracy is under threat from within.
Because you take my right to vote. You have taken my citizenship and my humanity. We who believe in freedom will not rest until it comes.
Does it make any sense that voting should be restricted to as short a time period as possible, and that citizens must stand in line for hours at a time? It makes no sense, and it cannot be justified. The right to vote is an American issue and sacred for every citizen. Together, we must move forward, not backward.
As an ally, we have seen the pain that our communities have suffered and the sacrifices that Black women have made across the country for generations.
You can tell when you winning in Alabama. They don't have the hose pipes no more. They don't have the dogs no more. The police can't beat us down no more. So the first thing they're going to work on is our voting rights. But I can tell you now, we got to stand, and we got to stand tall, and we got to stand hard, and we cannot go back.
Young people, pay attention. Just know what's happening. It's not just happening in states like Georgia and Alabama.
It's happening all across this country. And you also need to be on the right side of history. If we do not have the right to vote, we won't have a closing of economic disparities. We won't have fair and equitable growth. It matters who is in Congress.
All standing for justice and righteousness. That is the God of our weary years in silence here today. We are believing you right now. If we come together with our white allies, we will win in the end.
Fighting to ensure that those who cannot speak for themselves, those incarcerated, those of different religious backgrounds, those afraid to walk up to the polling place even with a legitimate voting registration card, fearful of what may happen to them, fearful of this debate, fearful that they'll be targeted. I walk in their name, and I walk in the names of those who never got an opportunity for 246 years to raise their head and their face to the sun and to be able to stand with us. I walk in the name of H.R. 40, the Commission to Study and Develop Reparation Proposals. I walk for the silent. I walk for those who will be silent. I walk to give them light and to give them strength. Carry on.
Thank you again. Thank you so very much. Enjoy the rest of your day.